Well, between the upcoming World Cup games and the success of the Kansas City Current, everyone has soccer on the brain.
That's right, and now your kids might be wanting to join a league or maybe, just kick it around in the backyard for a little while, but with all that excitement, there could be some risk for injuries. For more on that, we're going to turn to Dr. Matt Daggett. He joins us from Sano Orthopedics. Dr. Daggett, welcome in. Good to see you.
Hey, thanks for having me.
So, is this really true that soccer is a game that can strengthen bones and joints in kids?
Yeah, soccer is a great game for youth. The neuromuscular control that when you're practicing playing the game and the dependence upon obviously the lower extremities in the game of soccer really puts kids in a great situation to really develop that coordination over time, and it can really help improve the young kids' movement patterns.
Awesome. Well, Dr. Daggett, if kids are inspired by what they're seeing on TV, what are some good ways to help keep them safe while they're having fun at soccer? I know it's a kind of a tough sport.
It is, and unfortunately, this day and age, we're playing soccer year-round at a younger and younger age, and that early specialization in one sport really leads to a lot of fatigue, overuse injuries, and increase in even the traumatic injuries we typically see in the sport. So a great way to really get involved is at an early age is just playing in the neighborhood, playing with friends, just returning the play and the fun back into the sport. And as you get more serious into the sport, just make sure in grade school that you're playing multiple sports and you're not getting overexposure to one sport too much.
So what kind of injuries do you see when it comes to soccer?
Yeah, it depends on the age group. So in younger kids, we see a ton of overuse injuries. In fact, most grade school level sports, specifically to soccer, we see a ton of overuse injuries in that population. And those are things we used to not really see. Historically, we'd play one sport per season. And now with early specialization, we see a lot of these overuse injuries like heel injuries, growth plate inflammation injuries. And unfortunately, we see a lot more traumatic injuries at a younger age than we used to, such as ACL injuries in an earlier population and younger population.
And Dr. Daggett, you're the team physician for Rockhurst University. Are women or men prone to more injuries during soccer? I know it's a very, very hard sport, a lot of running.
Yeah, it's a very tough sport on the lower extremities. And you mentioned female soccer specifically, unfortunately, has a really high rate of injuries to the knee and ankle. We see a lot of female ACL injuries, and it's really tough at that age level too, because unfortunately, a lot of these kids, when they have one injury, they have a higher injury of injuring the other side as well. So it's really important to focus on prevention. Identify, warm-up patterns, how you just get ready for the sport each day, preparing for the sport with different injury prevention programs, both as a team and individually, and then avoiding fatigue. Too much of a good thing can be a bad thing. And really focusing on making sure you're not playing too much when you're tired or fatigued is a really important aspect to prevent these types of injuries.
Any last reminders for parents?
Yeah, just focus on the fun. Sports these days, especially at the grade school level and middle school level, none of these kids are really trying out for the Kansas City Current or the Sporting KC professional team at the age of 6. And, we really need to focus back on the fun and enjoy the time and development of the kids and the athletes and let them have fun. Let them get excited about the World Cup and go out, pretend they're, Messi or, whatever. Just have a good time with it, and then just balance it out and make sure that as athletes are getting older, that you're focused on those important injury prevention and screening programs that are available in our community.
Yeah, a lot of those youngsters out there imitating their heroes like Christian Pulisic, Messi, Ronaldo. All of those.
Absolutely.
Great
if
players.
only we had a Mahomes for the Team USA, we'd be in good shape, in soccer. So,
well, they're going to be better. They're in it this year. We'll see how well they do. We hope they go, at least into the round of 16. That would be great. So
that'd be awesome.
Yeah.
Cheering for him.
Dr. Daggett, great to see you. By the way, Pat's wrist is doing much, much better. I have not seen him smile as much as he has around the station here in a long while. So thank you very much. It's been a pleasure to work with him these last few days. So thank you.
Absolutely. I'm sure he's always smiling, but I'm glad to hear his wrist is better.
He is. All right. All this
Thanks
talk about Christmas movies.